there, I'm Tiffany Wibben, and I'm so happy you're here with me today. If there's one thing we've learned on this shared journey to elevate our dental hygiene practice, it's that teamwork and alignment make all the difference. Today we're covering a topic that can take your assessments and your patient care to the next level. Yep, we're talking about calibration and unity and assessments. Stick with me because this small shift in how your team approaches assessments can lead to big results for your patients and your practice. First, what exactly do we mean by calibration? When we talk about calibration between dentists and hygienists, we're talking about creating consistency in how patients are assessed and cared for. This means everyone on the team works from the same playbook, using shared protocols, definitions, and communication to keep care seamless. Calibration matters because when dentists and hygienists aren't aligned, the cracks start to show. Patients may hear conflicting information, recommendations may vary, and team members may feel out of sync. It can lead to confusion for everyone, and that's the last thing we want in a fast-paced practice. Beyond eliminating confusion, a unified approach to assessments actually improves patient outcomes. Think about this. You're assessing a patient for periodontal health, but your parameters for what defines mild, moderate, or severe are slightly different than the dentist. If you're not aligned, there's room for miscommunication, which could lead to delays in treatment or missed opportunities for early intervention. A unified strategy, on the other hand, ensures everyone is consistent, thorough, and clear. And when that happens, your patients don't just receive great care, they also trust your team more because they see that you've got your act together. Achieving calibration might sound like a tall order, especially if you're part of a practice that has different opinions and approaches. But don't worry, I've got some practical tips to help you get there. First up, regular team meetings focus solely on assessment protocols. These don't have to be long-winded or tedious. In fact, they're far more effective when they're short, structured, and specific. Set an agenda beforehand so you can hone in on areas where the team may not be fully aligned. For example, you might start by discussing how to classify probing depths or how to handle borderline diagnostic cases. Another tip, case discussions are pure gold for calibration. Take time as a team to review recent patient cases together and openly compare how different providers approach the assessments. Where were you aligned? Where were you different in opinion? By working through real-world scenarios together, you ensure that everyone gains clarity on how to handle similar cases in the future. Plus, these discussions are a fantastic opportunity to learn from one another and share insights. You're not just building consistency, you're building camaraderie too. Calibration isn't just a check-the-box exercise. It has a ripple effect across your entire practice. For one, the entire team is calibrated. It boosts efficiency. Less time spent clarifying for debating assessments means more time spent actually providing care. It's also a major confidence booster for both you and the dentist. When you're on the same page, it definitely helps, and patients feel it too. They feel reassured knowing that the entire team is unified in care. Before we wrap up, here are the takeaways I want you to remember. Calibration is all about creating consistency on how assessments are performed and patient care is delivered. Achieving unity between hygienists and dentists reduces confusion, streamlines workflows, and ultimately leads to better outcomes for the patients. So let's get started. Let's have those team meetings and get calibrated. Let's collaborate on all of the things that are going on with our assessments. And here's the challenge. Start today. Schedule that meeting and have those insightful conversations. Be the driving force for unity in your team, because when you're aligned, your patients benefit most. And really, isn't that why we're all here? Thank you all so much for tuning in today. Every effort you put into calibration and teamwork makes a difference on how patient experiences their care. Keep doing what you're doing, and I can't wait to see you all as you progress through this growth process. See you next time.